Good morning. Today we have Dr. Sharon with us. She is the holistic wellness expert at MCS, and she is also a wellness corporate wellness trainer and very well-known figure in Ayurveda industry. And she is with us to discuss about Ayurveda treatments in Kerala. So, doctor, can you just tell us about what are the common treatments international travelers ask for?
Well, we don't get a lot of global patients for Ayurveda treatment. Mostly they come for wellness treatment as a kind of rejuvenation, as a kind of relaxation treatment. And they do take holidays from their busy work and come to Ayurveda for a relaxation. We call it as Rasayana treatment or rejuvenation. Rasayana is the Sanskrit name. So that is only one part of Ayurveda. We do have different specialities, and specialized therapeutic Ayurveda is also that. That means for curing of diseases like chronic lifestyle diseases, diabetes reversal, and then hyperacidity, hypercholesteremia. All these conditions are very, very cured through Ayurveda. Not only through Ayurveda, lifestyle changes are also being merged into it. So yoga is also an important part which helps in curing these conditions. We do have other specialties also, like dermatology, general medicine, orthopedics, orthopedics, all these EI and ENT, all these specialties work together for having the desired result.
Okay, so apart from wellness treatments, what are the common disease conditions that you treat in Ayurveda?
Yes. So as I told, mostly people are coming for wellness, but we do have very specialized treatment option also for the disease reversal program. So in that, mostly people do come for orthopedics. And
ortho and neuro rehab.
Yes, neuro rehab. And we do have very specialized centers in ortho and neuro rehab. And that is a functionally on integrated medicine, wherein a very advanced form of physiotherapy is merged with Ayurveda equipment. And the different specialists work together so as to bring the desired result for the patient. And we do have a very good result in dermatology also, especially in cases of psoriasis and autoimmune conditions. Ayurveda is having good as.
And can you just tell us one or two cases where unique cases what we treated in Ayurveda here in Kerala? Can you just throw some examples?
I think you are aware about the Sriberium case in which the Prime Minister, a daughter of former Prime Minister of Kenya, came for eye treatment. She had lost vision. So after Ayurveda treatment, this lady got back her vision. So this is a very prominent case globally in which the efficiency of Ayurveda in eye and ENT disorders has come to the global public. And this has made Ayurveda much more famous, and the popularity of Ayurveda has grown much more in therapeutic cases. So this case is done in Sriberium Hospital. It is a 400-bedded hospital for eye diseases only. So we call this specialty Shalakim. Shalakim is a specialty in Ayurveda for eye and ENT disorders.
I remember Sri Narendra Modi ji also highlighted this case, and he was presented it in global forums as well.
Yes.
So I know this case is known to a global stage, and Ayurveda is known to people. And similarly, do we have any other cases which is very famous there are cases which is not treated by, there is no proper treatment by modern medicine where the Ayurveda has a treatment option?
Yes. There are numerous cases happening. That is especially happening in developmental pediatrics. So we do have 2 centers of excellence in Kerala for developmental pediatrics. Especially we have children with ASD, autism, hyperactivity, ADHD, and CP, cerebral palsy, who are treated very well, and many of their functions are improved. It is also integrated Ayurveda, not just Ayurveda treatment. We are providing that psychotherapy, behavioral therapy, physiotherapy, all these functions together. Only then we get the desired result. And these are 2 centers which is working very well in Kerala. We are getting patients even from other states also. It is Government Ayurveda Medical College Department of Pediatrics in Trivandrum and Government Ayurveda Medical College in Kannur. These 2 centers and Kottakkal Medical Colleges also having a very good department in pediatrics.
Okay, wonderful, wonderful.
Talking about developmental pediatrics, I would like to add about Pulamando clinic. So it is an Ayurveda clinic, Ashtavaidya clinic basically. So they are into genetic problems, especially of pediatrics, genetic problems of pediatric age group. So I would like to add that Malpe case in which the children were treated for a genetic disease. They had a neurotransmitter deficiency, which is a genetic problem, and the treatment prognosis is very less. There is no much result in conventional treatment for this. So they were treated in Ayurveda, and the child, 9-year-old child, is much better and is free from anti-epileptic medicine. It was on anti-epileptic medicine and is now free. So that is a miraculous result that has happened only through Ayurveda. So in every part of medicine, every department, every specialty, we do have an edge which needs to be explored, and more patients need to come to it. And even research studies is also happening globally in Ayurveda. We do have research institutes in Ayurveda where very good studies are happening. I hope that within the coming next 10 years, we can see tremendous results, which once again makes Ayurveda globally acknowledged.
So that comes to the next point of discussion, that is Ayurveda scientific, or how we can, what kind of research is going on in the field of Ayurveda, and what is the status now? How do we move this Ayurveda to a global platform where, there is a evidence-based medicines are more accepted? So how do we think about that?
Yeah. Evidence is very much essential and most important in any form of medicine. So that is which brings us forward. There is no much point in telling it is 5,000-year-old science and it has been practiced in generation. That does not provide the evidence that is required for us to accept, for the global public to accept that this is working. Anyway, all of us know it is working. It is an experiential knowledge that it is working. But right now, research is going on in that. We have institutes called as CCRIs, Central Institutes. Even in Kerala, we have two institutes. One is in Cheruthuruthi and one is in Trivandrum. Here, extensive researches are going on different projects, and different diseases are being treated. Understanding the efficiency of different medicines and protocols used in Ayurveda for disease reversal and things like that. But it is a long process. We cannot easily find out what is a cure, and a lot of people needs to be involved, and the funding should come, and the equipment, infrastructure, power should grow to a substantial level in which the great researchers can be done. And in a globally, researchers are being done. And Genome project I would like to add, in which the Prakriti analysis, or the basic constitution, everybody has a basic constitution according to Ayurveda, that was scientifically proven through genetic studies.
Okay.
So that was a big leap for Ayurveda, and that studies are being continued now also. So as I told in the earlier video about the Pulamando theory, we can understand the efficiency of Ayurveda medicines and herbs. Each herb we can understand, and the combination of herbs is through more researches. But the thing is that more specialized, more sophisticated infrastructure is anyway essential.
So that was a very insightful discussion. Thank you so much for joining with us. And we would like to know more about Ayurvedic treatments, options, and different treatments available to global population. So we will continue the discussion. Thank you very much for joining us.
Thank you very much. It was a pleasure joining. Thank you.